Hi, everybody. Welcome to Module 4, and this is Special Circumstances. We know that there are certain things that can happen throughout our shift that may throw us off, and these are just certain strategies to overcome those. The first thing we'll go through is patient boluses, and we know how detrimental that can be to our note writing, and it can throw us behind. The next is how to use dictation software. We want to be able to use dictation software correctly and utilize it to help us as opposed to hinder us. We'll also go through EMRs without dot phrases or quick select tools. And of course, we remember that we said in earlier modules, these are one of our most important things, but unfortunately, some rudimentary EMRs do not have these, and we need to be able to operate in those fashions as well. The last thing is going to be working with scribes. And something to consider is scribes are not physicians. We are working with typists, and we are going to discuss the best strategies for that. And that will be an overview of this module. We'll start here with patient boluses, and this is lesson 1. Here's what we'll cover in this lesson. We're going to talk about how to stay ahead of patient volume, and next we are going to talk about writing HPIs for unregistered patients. So, staying ahead of patient volume, this can be a critical thing. Sometimes we know as soon as we fall behind that our notes pile up, and what becomes really difficult is when we get overwhelmed with a patient bolus. So, primarily, staying ahead of our patient volume early on will allow us not to feel overwhelmed during a bolus. It's much different to get a bolus of 4 patients when you are caught up on your notes, as opposed to a bolus of 4 patients when you already have 4 notes to write. Now you're 8 notes behind. And that can feel very overwhelming and can begin to increase that stress and anxiety level during our shift, which we don't need any more of given our line of work. So during boluses, if a patient bolus comes in, 4 or 5 patients, and these patients are not critical, they are just leg pains, toe pains, a non-critical chest painer, we do not need to be going and seeing every patient right away. We can take 1 minute and start writing a note on the patients that we are seeing, and that's important to do. We already saw that we can start a note within a minute to a minute and a half, and that's critically important. And remember, again, writing your note is part of the patient encounter. Just like you wouldn't say, well, let me look at this chest painter's EKG in a couple of days because I'm so busy right now. We should not be thinking, let me do the note in a couple of days because I'm so busy right now. There are other opportunities to write notes. We can be busy if we're on the phone with consultants regarding critical patients. If we are calling to admit a patient, we can be writing the note through as we do this. And now that we have dot phrases, we've built up our dot phrases, we've built out our systemization strategy, and we know how to use quick select tools, we should be able to get this done as the phone is ringing to call a consultant or anything else. Another strategy here is attempting not to keep over 3 patient histories in your short-term memory. Again, as you keep more patients in your short-term memory, you'll begin to experience cognitive overload. It'll slow you down and overwhelm you. So as soon as you realize what your peak is, and when you begin hitting that number of patients where you become overwhelmed and you realize that your cognitive load is increasing, get to a computer and start writing down. If you know your note time is a minute and a half to start, that you know that it'll take you 4.5 minutes to complete those 3 patient charts. That's not too bad, and you can probably get that out of the way. So next thing is, we often get patients that are unregistered, and we think to ourselves, well, we can write this note a little bit later. That might not be the best strategy. I would say if you have an unregistered patient, open a notepad and write a quick HPI with your modifiers. Even if you don't have your dot phrases available to you because they're present within your EHR, just jot something down quickly. For example, if you have a laceration patient, he comes in, you can write, patient is a 10-year-old male, presents with lower leg laceration, exturation, just prior to arrival, course constant, onset sudden, character laceration. non-bleeding, no exacerbating, no alleviating factors. So quickly put that down. Now you have an HPI. Now it's offloaded from your mind and you don't have to think about it. And you can quickly put in a physical exam, just right lower extremity with 7 centimeter deep laceration. So this is something, and as the patient becomes registered, you can now quickly copy and paste that in and your note is complete. There's no more thinking about it. There's no cognitive load, and there's no stress from these patients coming in very quickly. So here's what we've covered here in patient boluses. We've covered the importance of staying ahead of patient volume. Again, this is critical. You do not want to fall behind. And falling behind can be extremely cognitively stressful. And second is writing HPIs for patients, even if they're unregistered, just to get that something on paper, get it off your brain. Hopefully that was helpful, and we'll move on to the next lesson.